It's too late for me to get my check here.
All right, thank you so much for joining us for this special broadcast as we look at period poverty. Now, before the break, we were speaking to learners at Noord-Geseg Secondary School, which is where we are tonight, talking to us about the difficulties that they experience when they get their periods monthly. At the same time, speaking to Siyagunagegela, an NPO that is starting a campaign, 25 Rand. They're trying to raise as many pads as possible in order to ensure that they assist as many young girls as possible. Now, I mean, in South Africa, out of 10 girls, 3 of them miss school during the period, and this happens each month. Now, research in 2018 that was done by the Bureau of Economic Research at the University of Stellenbosch says that while education of women is important, the reality that some girls miss school when menstruating puts them at a disadvantage, and this means that they're not going to be able to reach their full potential. The inequalities continue. They're not going to be able to do that which is in their hearts, which is school, and be able to further their studies at some point and have different careers. And to help us understand some of the challenges behind this and why exactly are we not moving to a time where young girls are able to get sanitary pads anyway and not having to pay for them. I've got with me Dr. Andile Dube, UNICEF South Africa education specialist, as well as Candice Chirwa, an activist and of course known to many of us as the Minister of Menstruation. Khanyisa Booi, editor, of course, Eve's Apple, Sexual Reproductive Magazine, and Asanda Ngwasheng, who's no stranger to the show, talking to us today. And she's of course a political analyst, academic, as well as a diversity trainer. Thank you so much to you all for your time. Candice, I'll begin with you. I mean, when we look at the relationship between girls missing school and the link between that and menstruation, others say we are not being truthful. There is no link to this. We should not even be thinking about that. Would you say that in the work that you've done, there is this link between these two?
It definitely exists, right? And I think the only way we can find affirmation in it is by doing more research interventions, and that isn't currently being taken place because menstruation is seen as such a taboo topic that when we try and sort of look at when a girl is sick and what she reports, she probably just says, I'm sick because, I'm just sick. She won't actually say, I'm sick because of my period. Even linking the fact that one is sick to their period is very problematic, but we need to acknowledge that it does hold young girls from going to school and any other social activities because of the lack of access to period products. But also beyond that, I think there is a lack of education, right? So when I think about my first experience, I thought about just how terrified I was. I didn't know anything that was happening. I thought I had a disease. I thought that I was going to die. And that is what often a lot of young girls feel. So we need to have more research interventions in South Africa that look at, if we provide period products to the specific school for 3 months, does the turnout in terms of attendance increase or decrease? What is needed in that? And I think we're heading in the right direction.
Dr. Dube, when we listen to this and talk about the absenteeism that some of the learners confirmed earlier to say that they do miss school because they're on the period, we're robbing our young girls of their full potential, are we not?
We are. But let me start by saying, firstly, there is evidence, there is research that has been done in South Africa. UNICEF 2 years ago did a study looking at girls and absenteeism and the causal link there. And of course, because the data and how it is structured in the system does not necessarily confirm that it's because of menstrual health, but we do know that it happens. And absenteeism is not only about the access to product, but it's also about the pain, because with menstrual pain comes absenteeism and staying away from home. But in this time, we really want our girls to be in school, particularly right now during COVID and all the learning losses and backlogs. We want our girls to access fully the school and teaching and learning. And so it can't be that one of the barriers becomes menstrual health. And so a lot of work has to be done in that area to make sure that girls have access to menstrual health, they have access to menstrual hygiene, and they have access to conditions within schooling that allows them to get into schooling. So it's not only just the product, but it is also the health aspect of menstrual health.
Asanda, we saw a few years ago the Project Dignity distributing reusable pads. You know, there's now menstrual cups and all of that. And some are saying that, where's the dignity, though, in not giving a young girl the choice if they want to wash their blood or they just want to dispose of the pad?
Yeah, I mean, I think that, you know, while reusable pads and the menstrual cup and other kind of interventions are good, often they kind of are good in environments where you have access to water. And so I just spent, you know, recently I spent 3 weeks traveling across South Africa, some of South Africa's most rural provinces. And what we're seeing there is that there's a lot of poverty, and not only poverty, but people are far from places. And so even just to access a shop, to actually buy the pads, if you have the money, costs a lot more than an urban child who has closer access would. And I think that, you know, with things like reusable pads, they are great, of course, but if you don't have access to water, if you're using a pit latrine toilet and all of those things that, you know, that basically surround the experience of having a period and the experience of actually using pads, you really have to understand the dynamics and the context that people are coming from. And I mean, I think also for me, what's really important and why I had to be part of this conversation is because, you know, we've made periods such a taboo topic, and yet it's something that happens to women every single month. And so when we talk about period poverty, we're not just talking about experiencing this poverty, you know, at one stage or another. We're talking about a monthly occurrence. When you talk about shame that these girls are experiencing, we're talking about a monthly occurrence. And so even the whole thing around missing school, you're not just having kids missing school like once in a while. It's literally every month, which when you calculate it over a period of a year, it's quite a high number. Yeah. And that does lead ultimately to people then kind of missing school and falling behind. And we already know that young girls struggle to make it to matric, and young girls often struggle to make it to post-matric. And this is such a basic natural thing that you have no choice. You can't opt out of periods. And so if it's something that happens to you naturally and you don't have a choice about it, why then is government able to give out condoms, but they're not able to give out, you know, pads?
And I'm going to get to that point because I want us to talk about that if the health department is able to provide contraceptives and condoms and all of that, why are we not moving towards pads? But Khanyisa, let me bring you into this conversation, because one of the things that we also see around menstruation is it's not only taboo, but sometimes boys take it so lightly. When you talk about menstrual cramps, it's like, oh, you're being a crybaby. Why are you even bothering us? And that also is part of the problem.
So I think for me, one of the biggest things is the sexualization of the entire period, right? So you're not allowed to feel what you're feeling. You're not allowed to actually have that period because it's coming out of your vagina. And so because it's coming out of your vagina, whatever experience boys have, whoever's speaking to the boys is speaking to them as if it's a sexual thing, and it's not the most natural thing. Not that sex is not a natural thing, don't get me wrong, but it's not. It's like a monthly thing that happens. It literally happens to you. You can't opt out. And so for me, I think the biggest thing is desexualizing sexuality education, putting menstruation at a place where people can learn about it and it doesn't feel like a sexual thing. One of the reasons why it feels like a shameful thing is because girls think, oh, there's something wrong with me. You know, one of the girls earlier was speaking about the shame attached to it. And the shame is the sexualized nature of the education. And so the exposing boys to sexuality education and making it, you know, if you're getting a morning boner, it's a natural thing, right? And so why is getting a menstrual, because that's at the end of it also, a period, that bleeding, an unnatural thing. So for me, I think there's things that are generally accepted and there are things that are just sexualized, and because everything that's sexualized is then taboo, there's no real access to education for boys. And also an undertone of that is also irresponsible because then a person grows up thinking that they can laugh and, you know, they don't have to get involved. And then, you know, then the rest of the society can actually shun girls, and girls can continue to feel shame, you know. I'm saying girls, but I actually mean across the board menstruators. If I'm a lesbian person, if I'm a transgender man, I still menstruate, and I don't have the space to say what I'm thinking or feeling because shame primarily because of the sexualization of the process.
And even shame, Khanyisa, when, you know, someone spots the blood and it's, you know, you had a spillage, it's almost like, oh my goodness, let's put you in a room because something that is so grand has happened.
At my grown age, I still kind of check. I mean, far less shame for sure, but I still, like, when I stand up and I can feel the rush, I'm like, yo. I cannot begin to imagine what a 9-year-old, because menstruators are studying earlier and earlier, is thinking or feeling at the time, especially when the young ones don't even understand, and if they do, they think it's a sexual thing, so maybe it's happening in the vagina, and therefore then shame attached to it.
Candice, one of the things that, you know, Asanda mentions is pit latrines. You know, one is very disappointed that in 2022 we still talk about pit latrines. That robs a girl of really having their menses in private and even the dignity of it all that is attached to the sanitation and the entire process, does it not?
It does. And, you know, the key word there being dignity, because we often forget there are so many different resources we need access to in managing our period. Beyond just a toilet with flushing water, we also need water to wash our hands, a bin to dispose the products if we're using disposable period products. So the reality of many menstruators in this country still using pit latrines is still something that we need to have a conversation about, and also understanding that when we're speaking about menstrual health management, there needs to be a holistic way we solve it, and not just focusing purely on giving access to period products, right? So I think that's something that we need to think about. When we think about period poverty, we really need to think about the experiences that menstruators have. We also need to consider menstruators who are disabled. How do they access the facilities and still manage their period? You know, menstruators and prisoners, menstruators who are refugees, who are homeless. This world of period poverty, although yes, focuses on the girl child because it is a human rights issue, there's still so many people who are affected by it.
And Dr. Dube, right at the back of that, refugees, you're fleeing a war-torn country, you're trying to feed your kids, you're trying to protect them, you're trying to get a toilet. Now you have to deal again with your period.
Yes, with all the girls, I mean, particularly the refugees and undocumented children, it really is a difficult one. I really want to start with the children who are in school, who are undocumented and who are refugees. There is a sanitary dignity program in schooling, particularly at no-fee school, no-fee schools. And we really want to ensure that all girls, whether they are South Africans, whether they are undocumented, whether they are refugees, get access to pads because it is dignity, in line with the framework that was adopted in 2019, in line with all of this investment that has been made by government, and in line with what partners are doing around just making sure that there's access. And so it becomes even more difficult when you are considered a person who should be hidden from society. And so you have to hide as a human being because you're undocumented, and then hide as a girl because you can't have the same access. So when we talk about sanitary dignity program, we say for all girls, for all women, for all people who are from disadvantaged background, but also whose access can be buried by a number of other issues. So for girls who are undocumented and for refugees, we also are talking about the same cohort of young kids. We want them to be able to access products, the period-friendly sanitary environment, which is toilets in this case, the simple thing, but to be able to also receive the same dignity that we want girls who are South Africans to receive.
Asanda, it's very disappointing that, you know, where we sit today, you know, almost 30 years into our democracy, you walk into a public toilet, you're able to find a condom very easily. But a young girl is not able to walk into a public toilet or school or wherever and be able to just pull a pad and you know, quickly be able to use it.
Yeah, I mean, it's just yet another way in which patriarchy and the lack of recognition of the humanity of women is constantly and consistently trampled upon. Because if there is an understanding that in order to kind of in order to prevent people from producing more babies, if there is an understanding that to prevent STDs that we need to provide condoms because poverty means people may not be able to afford them, then consequently the same argument should be made for sanitation, because if you can't afford to buy, whether it's pads or reusable materials or the menstrual cup, what it means is you are also, on top of it, the shame, on top of everything else, it's a constant reminder of the indignity of the poverty that you are facing. On top of it being a constant reminder of the indignity that you are facing, it's also yet another reminder that as a woman, you are less than. That as a woman, there are things that happen to you in your body that you have no control over. And if you think about the kind of period of your life that you have, like a woman experiences menstruation until menopause. And so you're talking a good 30, sometimes 40 years of your life where you are experiencing this. And if this is torture, if this is happening in poverty and you are unable to care for yourself, then that is a problem. I mean, I've been in conversations with many people where the inability to buy a pad almost becomes a measure of the indignity of your poverty as a woman, where it's like, I was so broke, I didn't even have money for pads. I had to ask a man to buy me pads. And this is the country that we're living in, that promised to deliver freedom, that promised to deliver access to health, and all of these things. And I want to add also that, we've spoken about pit latrines, but we also know that South Africa has high levels of informal settlements. Yeah. And in informal settlements, it is groups of people using this toilet, which as described earlier, that when you're on your period, you need access to a bin. There's no bin when you're using this toilet with hundreds of people. When you get to the toilet, it's so dirty that you have to first clean it before you can use it. And often you're using a toilet that is either cleaned with chemicals or something else. It is not a flushing toilet. And also what it means is you are walking to that toilet with the pad or whatever implement you're going to use, which means you kind of have to broadcast your period to the whole community that this thing is now happening to me. And the duration of your time in the bathroom is also an indicator in an environment where there are 5, 10 toilets to hundreds of people. And so you are taking up time, and people are going to be asking you questions about, we need the toilet, why are you taking so long? And so the indignity of poverty in South Africa keeps getting replicated, whether we're talking a rural environment or we're talking an urban environment. And there doesn't seem, from a government perspective, to be an understanding of that. When we talk about period indignity, we're not just talking about, blood coming out of your vagina. We're talking about, as said earlier, the emotions. We're talking about the shame. And we're talking about this constant reminder that you are a woman who has no means in a country that doesn't care about people.
I'd like to bring you in right at the back of that, Khanyisa. I'm listening to this, and I wanted us to go to this response as a country. Is it coordinated? Because there's a Ministry of Women, they're doing this, but we also know in Parliament, they were also talking about shortfalls in their own, delivery of sanitary pads, the social development. So is this a coordinated response by the country to deal with this challenge?
There is no coordinated response. I think there are pockets of people who mean well, and those people kind of do what they can with what they've got, whether within departments or outside of departments. And of course, the NGO sector is fairly responsive. And there's also individuals who try to do the work and to make sure that girls do have access. But as a government that understands how the human body works and the necessities thereof, there's literally no coordinated response. And it is showing what Hassan is saying about patriarchy that disregards and disengages completely and denies you the right to dignity. If in South Africa, the central thing is the right to human dignity, menstruators don't have it. And the government is not at all intentional about making sure that there's a move towards ensuring that menstruators are able to access dignity. I mean, there are budgets on budgets on budgets. I remember there was budget talks about access to period wear. And that kind of fizzled away. And you have development partners who step in and try as well to do the work. But at the end of the day, fundamentally, the people who are mandated to create an environment where citizens are able to thrive actually don't care. And it shows itself every day.
And as we are wrapping up then this conversation, I'm going to bring you in because you are nodding profusely. Very briefly, let's talk about this response, what a coordinated response would look like.
Yeah, I'm nodding to everyone. Everyone's saying really great things about how we sort of eradicate period poverty. But I think cross-collaboration is key. I speak on my own experience where for the past 5 years we've been educating young people through fun workshops, right? So we come into a space, we have them educated, we have them empowered, and this is very different to other sexual experiences, sexual education experiences. And I think cross-collaboration is key, where NGOs who are on the ground constantly trying to eradicate period poverty or any sexual ed issue are trying to ensure that, you know, people are equipped with the right information and education. So the only way we can have this is cross-collaboration with government, but also I think we need as a society to talk openly about periods. So everyone that's watching this broadcast right now needs to understand that they each have their own social responsibility in eradicating period poverty, and that starts with them. It starts with them asking the question, how do we end period poverty? Why are periods viewed so negatively? And what can I do to help?
And they should not switch off to say that kids go to bed.
Yes.
This is a topic that you're not supposed to hear. They should not be, and they should be watching. How do we begin to change, Dr. Dube, as we wrap up very briefly, the negative perceptions of periods?
I think we need to educate. So if you remember, the theme for menstrual hygiene this year is men and boys as conduit. It's making menstrual hygiene normal. So we need to educate and educate and educate. And we need to hold those who are supposed to be implementing the programs accountable. For an example, we know that there is, at a political level, there is buy-in. We know that cabinets adopted the framework. We know that the NTNEF has allocated budget. But we need to be able to say what happens between that allocation and the money and the implementation. And we need to make sure that as South Africans and as UNICEF, this is one thing that we always are constantly talking about. As the UN agencies, our role is to make sure that we educate the nation, we hold everyone accountable, we make sure that those cross-collaboration between government, between Department of Women, between Department of Education, Social Development and Health, as created and in a platform for sanitary dignity, continue to happen. So we need to be working together and hold each other accountable.
Let me thank you all. Unfortunately, that's where we need to leave it, but thank you so much. And the last point you mentioned, Dr. Dube, is critical because we'll be able to track how many girls are missing school, monitor what is going on, monitor the response, because the heart is at the implementation. Budgets after budgets, the allocations are there, but what is exactly going on at grassroots level is a different story. So thank you so much to you all for coming through. And of course, that is our panel as we were trying to really look at some of the cross collaborations, as you know, Candice calls it. What do they look like, and how do we then begin to address this particular issue? So let me thank Dr. Andile Dube, UNICEF South Africa Education Specialist, Candice Chirwa, an activist, of course, known as the Minister of Menstruation, Khanyisa Booi, editor, Eve's Apple, Sexual Reproductive Magazine, as well as Asanda Ngosheng, who's a political analyst, academic and diversity trainer. When we come back, we take a look at what is going on the ground. Of course, there are people who work with young people every single day, young women. What stories are they hearing, and what should we be learning from these stories that the young women are telling them?